the station working for you. This is WRTV News at 11, streaming now.
It's been a possibility since the beginning of this unprecedented school year, and by the end of the month, all Marion County students will be out of the classroom and back to virtual learning. Good evening to you at 11 o'clock. I'm Mark Mullins.
And I'm Amanda Starantino. That's one part of a new county health order that tightens restrictions as COVID cases skyrocket. Some school districts are going remote before the required date. The changes are forcing many parents to scramble. WRTV's Cornelius Hawker shares how some are coping and where you can find resources.
Structure is really important for us. It's important for our kids.
This pandemic, however, has thrown parents like Jessica Moore for a loop, figuring out how to maintain some semblance of normalcy during these uncertain times.
Even when we first went virtual in March, we were trying to think about, what do we do to help to recreate a new structure for the kids during the pandemic.
With COVID-19 getting worse in our community, she knows her kid's private school will soon go back to virtual learning, and they're preparing for that as a family.
I think regardless of what the school's decision is, the ultimate decision is going to be what's best for our family.
Schools in Marion County, public and private, have been ordered to go to virtual learning by November 30th. This order will last through January 15th. Jessica hopes the government steps in to offer some help during this time because she knows so many folks are going to struggle with this change.
Whether it's through employment, through health care, access to food, child care, because there are a whole lot of folks who are essential workers who are still having to go to work every day and then trying to figure out what you're going to do with your kids.
Working for you, Cornelius Hawker, WRTV.
There are currently 3 community learning sites open across Indianapolis where parents can bring their students for a day of free supervised e-learning. Those sites were recently extended through December 17th. You can find the locations and register at communitylearningsites.org and head to WRTV.com to check your school district's plans for the transition to virtual learning.
Here are some other new restrictions under the latest Marion County public health order. Self-service buffets, salad bars, and karaoke, they're all banned. The midnight closure requirement is expanded to all non-essential hospitality and entertainment businesses. Indoor capacity is reduced to 25% at several places, including bars, museums, cultural sites, movie theaters, bowling alleys, entertainment venues, and gyms. Mayor Joe Hogsett says right now, no one is winning in the fight against the virus.
I take absolutely no joy in making these changes. In fact, it's heartbreaking for me as someone who loves this city and desperately wants to see a speedy recovery from the effects of this pandemic. But my heart also breaks every day when I receive a report on the deaths of our neighbors who fall victim to this virus.
Special or seasonal events like sporting events, conventions, weddings, receptions, and more are now limited to 50 people. That's unless the event has an improved safety plan from the Marion County Public Health Department. All other social gatherings are limited to 25 people.
New tonight, one of the first COVID patients in the country to receive Eli Lilly's new FDA-authorized antibody treatment is being treated in Indiana.
1 week ago, this would not have been possible for me. And it probably would not have been possible a few days ago. The timing could have not been any better for me.
David Schultz was given bamlanivimab at Clark Memorial Hospital in Jeffersonville. Schultz is a doctor on the front lines treating COVID patients. He tested positive for the virus himself a couple of days ago. He described how the treatment worked.
They hooked me up to an IV, and they gave me the 1-hour infusion of the monoclonal antibody, and then observed me for about an hour after that and sent me home. It was a very easy process. There were no side effects to it, and I'm assured that this is going to speed up my recovery, as all the research shows that.
Patients eligible for this treatment must be at least 12 years old with mild to moderate symptoms and likely to develop the illness more severely. Availability is limited. If you believe you are a candidate for the new treatment, you should call your doctor or medical provider.
Top doctors at IU Health say roughly 200 nurses are either sick with COVID-19 or under quarantine because of exposure. Either way, the shortage is creating a strain on medical staff at IU Health facilities. Doctors call the current state of the pandemic out of control with the record-setting high daily numbers that we're seeing. All IU Health medical centers across the state are caring for more COVID patients. A different picture from the spring when the majority of cases were being handled by hospitals in the Indianapolis metro area. Right now, there are 278 COVID positive patients at IU medical facilities. We're also learning more about the plan to store and distribute the coronavirus vaccine when it arrives to Indiana. It needs to be in a freezer.
As you know, we're expecting the first vaccine to be the vaccine from Pfizer, so it needs -70 °C storage. The state has developed a very nice comprehensive plan for vaccine placement and distribution, and a lot of it will be coming directly to around 50 hospitals. But there are 5 sort of pre-placement large hospitals scattered around the state, and our IU Health Methodist Hospital is one of those. So at some point, we don't really know when, we'll get a shipment that we need to keep in ultra cold storage.
The FedEx hub in Indianapolis, the company's second largest express hub, recently installed ultra cold freezers to help ship COVID-19 vaccines once they're available. The shipping giant says it has been planning for months to handle the transportation of vaccines as they are approved for use. When it comes to Thanksgiving gatherings, the IU Health doctor that we spoke with says that it's not a good idea. He advises keeping your group small. Keep your distance with other guests. Don't hug. He says this is the time to double down with safety precautions and not the time to relax.
Now to the forecast, Kevin. We're not quite looking ahead to Thanksgiving temperatures at this time.
No, but maybe we'll get lucky. You know, we've been on quite a roll here, and we've got some cool temperatures, at least in the short term, so maybe it'll flip again by then. Just want to show you the Gray's cloud cover. There's some rain showers over northern portions of Illinois. Can't rule out a few overnight sprinkles, but it's not going to be a big deal. Kokomo's at 36, 37 in Muncie. Temperature in Indy at 44. It will be warmer in the morning, certainly, than we were this morning. Still cold, though, in the mid-30s. Lots of sunshine, breezy, and dry. Your Friday high temperature will be in the upper 40s. We've still got to talk about weekend conditions. We may have some thunderstorms, definitely some gusty winds, and changing temperatures. That's all ahead.
A giveaway happening this weekend could be coming at just the right time for families preparing for winter during the pandemic. WRTV's Cameron Riddle shows you how an organization is helping kids stay warm and safe.
The COVID-19 pandemic has changed just about everything from the way we shop to the way we socialize, but it is not stopping grassroots organization Creating a New Society from hosting their 6th annual coat drive, but with some changes.
We are doing coats again. It is a lot different, actually.
For Nicole Glass and her team, the first change is the noticeable increase in demand for new coats. The pandemic has left many families with less money at a time when most would be preparing for winter.
There is children that need coats now more than ever. Parents losing jobs and the downsizing. So we are anticipating greater numbers this year.
The group plans to give away more than 400 coats from inside the safety of the John Bonner Center. Any family can have a coat as long as the child is present. But how can families stay safe while waiting in line at a time when COVID cases are skyrocketing? The John Bonner Center is taking a number of precautions. Temperature screenings will be taken before you ever step foot inside the door.
Normal temperature. Thank you.
Multiple sanitizing stations will be within arm's reach. Masks will be required, and social distancing will be strictly enforced.
We've put in a ton of safety precautions, like I said, to keep ourselves as well as the public safe.
While the pandemic has given us all something to worry about, Glass says keeping a child warm should never be on that list.
I'll say it again and again, no parent should have to have that worry keeping their child warm. No child should be on their way to school and have to worry about the frigid temperatures.
Cameron Riddle, WRTV.
And the coat drive is this Saturday starting at 9 a.m. at the John Boehner Center. The coats are free for kids 17 and under. The only requirement is that the child be present. Any family that arrives can also take home free food to feed their family. It is all while supplies last.
State lawmakers are responding to election problems uncovered by WRTV Investigates. Senator J.D. Ford says Indiana's election laws need a makeover. Ford is a member of the Senate Elections Committee. We shared with him our findings following the 2020 election. Some voters told us they never received an absentee ballot in the mail, while others were given conflicting information on whether they could change to vote early in-person voting if they had already requested an absentee ballot. WRTV Investigates found those answers depend on the county.
I'm deeply concerned about that. If you are a voter in one county that's allowing it to happen and you're a voter in another county that's not allowing it, you're like, well, why is the process different? Well, I mean, it doesn't seem fair. And so I think that's where we need to step in and provide that clarification.
Ford is proposing an election modernization bill that would also extend hours at polling locations, allow ballot receptacles around the community, allow no excuse absentee voting, and create a process for ballots to be tracked much like you track a package, and allow for vote counting to start the day before Election Day.
That's a lot of money, and it's money that people spent on housing and food, and they have no way to get it back.
Could it happen to you? Why the government is forcing some people to pay back their unemployment benefits.
I think that's been the hard thing too, is explaining to them why they can't go play with their friends and have sleepovers and stuff like that.
Healthcare heroes are not the only ones making sacrifices due to the pandemic. Next, how the COVID crisis is impacting entire families.
My name is Warren Gavin, and I'm a medical doctor and a hospitalist here at Methodist Hospital.
My name is Myra K. Whitaker, and I'm a staff chaplain here at Methodist Hospital.
My name is Jody White, and I'm a respiratory therapist at Methodist Hospital, downtown Indianapolis.
My name is Brandy Copsis Kingsley, and I am a shift coordinator at University Hospital for the medical intensive care and rapid response teams.
Last night on WRTV News at 11, Central Indiana healthcare workers shared the tumultuous journey the coronavirus pandemic has been for them at the hospital. Tonight, they share with us the emotional toll of the pandemic and, while fatigued, how they find hope to keep fighting. How would you describe this year?
Oh, chaos. Frightening. Unpredictable. I don't like unpredictable, so it's been very scary. In hopes that it gets better. I can't believe it's lasted this long.
I think when you go into healthcare, you sign up for anything, right? Because like when we study medicine, you always learn about pandemics throughout history, and nobody could have expected this.
The numbers we see every day are people who healthcare workers across Central Indiana have fought to save.
It's been difficult, and it just stops you in your tracks. How many patients we've lost, and so how do we cope with that? You know, I'm not sure.
Rising coronavirus deaths are a harsh reality that thousands of families are experiencing, and a daily struggle for medical professionals and hospital staffs.
What made you say yes to that call?
Because I know a lot of people don't want to do it. And I'm very capable of doing it. And I wanted to help these people that don't have the help that they may have needed. So there was many of us that was like, and I was one of them, was like, okay, I got this. This is what we're going to do. This is what needs to be done. This is my job. Like, this is what I need to do.
Pushed to their limits with no reprieve in sight.
Like, we keep having these surges because people are, you know, relaxing and like, oh, it's fine. Wear your mask, they're with your friends. You know, have hand sanitizer locally so you can wash your hands regularly. It's simple as that, and people just aren't understanding it, and it's frustrating. It frustrates me.
We've all been stressed, and we're putting in more hours, and we're really learning what our limits are. Personally, professionally, education-wise, what physically our bodies can handle, and then for people to not wear masks or to fight the social distancing, or to say it's a political issue. You know, your life is not a political issue to me. I'm gonna come in every shift, and I'm gonna treat you like you're my family, and I'm gonna give you the best care I can. And so that's really hard.
Their fight against COVID does not end when they leave work. making their career sacrifices a sacrifice for the whole family.
I have a mother that lives with me. She's 87 years old, so I'm concerned about taking something home to my mother.
We really, all of us, sat down as a family and decided, you know, what am I going to do? They've seen me gone for longer than usual during all of this. And so I think they also connect that mommy's gone because she has to take care of others with this.
You make your way to the basement and try and do what I call decontamination, you know, after coming home. Even that part is a little bit difficult because you have a little 5-year-old girl who's there waiting to put her arms around you and hug you, and she's got to wait an extra half hour. And so, you know, all those things have been difficult, but we've kind of worked together.
The time they get with their families made bittersweet by what they've seen other Hoosier families go through.
Having to watch the doctor or the nurse take an iPad in with the family so they could say goodbye. That was horrible.
This patient is going to die. Yes, they just got sick a couple days ago, but now you have to realize that they're not coming home. That is an empty chair at Thanksgiving. That is a person that will no longer have memories with you anymore, and I think that's the hard thing.
And these heroes admit fatigue is setting in as the number of cases rise.
In the beginning, it was, oh, we love our healthcare workers and, you know, sending meals to the hospitals and having these, you know, the prayer trains they've been having. And you can't be that person and then also not wear a mask because we're still fighting and the numbers are rising and the hospital admissions are rising and the deaths are rising. And anything that we can do as a community to help each other is just gonna help everybody.
But hope is what keeps them going. And knowing that their work is helping people return to their loved ones.
They understand that now they can go through a lot, they can conquer a lot, they can come through a lot, so that even though a lot of them may have had other health issues, it's not the end. They still recover and they go on and have a good life.
With this, it's really shown us what we're capable of and what we can adapt to.
I, like everyone else, hang on to the idea that there will be an end at some point, and that my family stayed safe, and that the majority of patients are doing well.
And it's not hard to see how much this has taken a toll on our healthcare workers. We can help them help us. When I spoke with each of them, they all shared the call to action for all of us to simply wear our masks, wash our hands, and keep some social distance. It's not a very big ask when you see everything they are doing for us.
It's really not. Well, if you'd like to get a head start on helping others this holiday season, WRTV's annual toy drive kicks off on Saturday. We're teaming up with Christmas Nights of Lights at the Indiana State Fairgrounds. $1 for every ticket sold on Saturday will go to the WRTV toy drive. And I'm Kevin. Yeah, I know you're excited about this.
Absolutely. I'll be out there as a preview tomorrow night. You can watch that during our early news. There are some million lights synchronized to music at the fairgrounds. Let's hop to it. Let's tell the story of your Friday. Temperatures stay cool all day. We'll be lucky if we hit 50. Probably not, but at least we'll have sunshine. A good night for Friday night football. Temperatures fall into the 30s. It stays dry. Skies will be partly cloudy. Okay, the weekend becomes more interesting. Chance for rain will increase in the afternoon Saturday. The most likely time Saturday night, even with some thunderstorms. The morning high Sunday is 54. Then we don't warm up. We may actually back up as far as the temperature is concerned. There's your rainfall potential for the weekend. Really most of that Saturday evening through early Sunday morning, about 1/3 of an inch. The pressure difference between low pressure around Lake Superior and high pressure in Colorado will create the very strong winds. Indications are we'll have wind gusts over 40 miles per hour. I think the peak winds will come late Saturday night into the early overnight hours. There are some of the wind gusts at 1 o'clock in the morning over 40 miles per hour, and it's still a strong, colder west wind on Sunday. Saturday high temperatures in the afternoon around 50, but they'll slowly rise in the evening as the warmer air pushes in with the rain and isolated thunderstorms, a couple of which could be strong, with wind being the main threat because it's going to be windy no matter whether we have thunderstorms or not. Here's your 7-day forecast. Windy and turning cooler Sunday, 54 degrees. Most of next week looks dry with temperatures warming up Wednesday into the low 50s, and we'll be about 57 or so next Thursday. We'll be back with more news right after this.
The Rebound Indiana is showing you how organizations are stepping up to help feed Hoosier families as the pandemic continues. There is a unique operation inside of Eskenazi Health. Since mid-July, Eskenazi has teamed up with Gleaners Food Bank to create a network of distribution locations to combat hunger. It's a project made possible through funds from the USDA's Farmers to Families Coronavirus Food Assistance Program. It's a fast-growing initiative thanks to a thriving volunteer base and a growing need. Eskenazi tells us the holistic health of people in our community is important as we work to fight the virus.
You can see we've got some of the boxes here. These individual boxes are getting passed out at our 3 different food distributions that we do throughout the city on Mondays, Wednesdays, and Fridays. You know, we continue to step up our efforts to get the food out into the community and make sure that it's getting to the folks that need it the most.
Through this initiative, Eskenazi Health expects to serve more than 32,000 families by the end of the year. Eskenazi is also helping feed the community through a partnership with Second Helpings. For more on times and locations of distribution sites, go to WRTV.com/rebound and click on this story.
People across the country are getting notices saying they must pay back their unemployment benefits, and sometimes the bill is for tens of thousands of dollars. Scripps reporter Alicia Neves explains why this is happening.
Bills are mounting for many Americans, and another one being added to the pile for some on unemployment is a bill to pay back the money they were given.
This is a massive financial hardship.
Michelle Evermore is with the National Employment Law Project and explains the notice to pay back unemployment is most often due to an error somewhere in the application process or when an applicant filed for continued benefits each week.
Either the agency made a mistake or somebody clicked a wrong button on a form somewhere and are now being informed that they've been overpaid for months and have to pay back tens of thousands of dollars.
In some cases, if an error was found on 1 week, the agency disqualified people for the entire time they were on unemployment.
That's a lot of money. And it's money that people spent on housing and food, and they have no way to get it back.
It's unclear on a national level just how many people are getting notices of overpayment. States are just starting to look into this and report. But so far, Texas is seeking refunds from 260,000 people. Ohio says it's overpaid at least 160,000 people. And in Virginia, the number of people overpaid is around 35,000.
We're going to see a lot more of this happening in a lot more states, and we're going to hear a lot more horror stories if this legislation doesn't move.
In its stimulus package, the House of Representatives has included legislation that would waive the unemployment overpayments as long as they aren't considered fraudulent activity. But the package is unpopular with the Senate. NELP believes the forgiveness is critical to those on unemployment and our economy.
It was estimated that during the last recession, every dollar spent in unemployment insurance generated $1.61 in local economic activity. So imagine that in reverse. Imagine that money getting sucked out of communities as we're still in very rough economic times.
Without federal waivers, that could be a reality. I'm Alicia Nieves reporting.
No doubt we'll end the work week on the cool side. Temperatures only work their way to the mid-40s by noon, about 47 to 49 for the afternoon high, but it does come with sunshine. And Mark, Rory Gregory says good night. She's not down here with me tonight in my basement studio. She's called it a night.
That's it for her. All right. Good night, Rory, and good night to all of you at home. Thanks for joining us for WRTV News at 11. The GMI crew heads your way at 4:30 tomorrow morning. Have a great night, everybody.